Welcome to Health and Wellness. I'm Will, nurse practitioner, and today we're going to be talking about the difference between a nurse practitioner like myself and a physician or a doctor. Maybe you're just curious, or maybe you're a medical professional to be who's wondering which path they should take. This video is going to be perfect for you. Over the next few minutes, I'm going to walk you through the differences in their education and training, as well as how their job roles actually differ. Then I'm going to let you know which one that I think is better. And guys, I might be a little biased. Clear! The path to becoming a physician is a long and difficult one. First, they must obtain their undergraduate degree, which is usually in something like biology or chemistry. They have to make sure that they complete their prerequisites for medical school. During this part of their education, they're usually not learning anything specific to medicine. Once they graduate, they attend medical school, which is basically 4 years of intensive training. They learn in-depth medical sciences as well as clinical information for practice. During their last 1 to 2 years of medical school, they're completing clinical clerkships in just about every specialty imaginable. By the end of their medical school, they have about 6,000 hours of formal clinical experience. And when they graduate, they officially earn their MD or DO degree, and they are officially physicians. However, their training doesn't stop there. Most will then match into a residency, which is basically on-the-job training for about 3 to 4 years, but some specialties like surgery can be 7 or more years. During this residency training, they average more than 10,000 hours of on-the-job training and education. Once they complete their residency and pass various board certifications, they are officially attending physicians. Basically, at this point, they are independent providers. Now let's switch gears and look at the path of a nurse practitioner. And I do know this one fairly well because this is the path that I took. The most common route will have them attending a 4-year college and obtaining their Bachelor's of Science in Nursing. Nurses immediately dive right into learning medical conditions and treatment modalities in their undergraduate education, learning to be bedside nurses or registered nurses. During this nursing education, they also complete about 800 to 1,000 hours of clinical in the hospital, learning how to become a bedside nurse. Once they graduate and pass their board certification, the NCLEX RN, they are officially registered nurses and immediately jump into the workforce. Not all nurses will decide to go back and get their nurse practitioner, but those who do usually wait an average of about 5 to 15 years. However, there is no minimum amount of experience required for most NP programs. When they apply to a nurse practitioner program, they are applying to a specific patient population. So that means that their education is geared towards the type of patients that they're actually going to be seeing and treating once they graduate. Most will complete their master's degree in about 2 to 3 years. Some do choose to jump right into getting their DNP, which is their Doctorate of Nursing Practice, and this will take about 4 years to complete after your BSN. When an NP graduates, there is no formal residency. Once they pass their board certification, they can immediately begin working as a nurse practitioner. Now, there will be formal on-the-job training while at work, but this isn't considered a residency and will be highly facility dependent. When a nurse practitioner begins working, they work in close collaboration with other experienced nurse practitioners or other physicians. This is called collaboration. In many states still, an NP has to have a collaborating physician on file, which is someone who they can call if they have any questions, and someone who might review a few charts every so often. Both the paths of becoming a nurse practitioner or becoming a physician are not easy. So looking at them side by side, as you can see, this is a pretty big difference in numbers, 16,000 versus 1,700. And in my opinion, the education, training, and supervision of physicians is more rigorous than nurse practitioners. However, I'm not going to completely disregard the benefits that the NP education path can have. First off, there's more healthcare exposure and education of medical conditions early on while they're in their undergraduate education. They'll be going to clinicals in hospitals and learning medical information from the get-go. Pre-med students usually have little, if any, medical exposure. Additionally, NPs will have years of experience working as a bedside nurse. While this is definitely not equitable to formal education and training learning to be a provider, I don't think it should be ignored either. It exposes them to medical conditions and disease management, improves their assessment skills, and builds on their communication with their colleagues as well as with their patients. I think it's clear that our formal education and training is less than that of a physician. However, I do believe our education is sufficient. And now let's talk about the actual job role differences between that of a physician and that of a nurse practitioner. Now, this is going to vary depending on which state and facility that you work in, but usually the job roles are very similar. Both physicians and nurse practitioners obtain health histories, perform physical assessments, order and interpret labs and diagnostics, order treatments such as medications and therapies, as well as consult appropriate physicians or specialties. In many facilities, NPs work in close collaboration with physicians. So which do I think is better, the path to becoming a physician or the path to becoming a nurse practitioner? I think that's a very difficult question to answer, and I think it's going to depend on you. Becoming a physician will offer years of formal education and training, in-depth medical knowledge, like you'll know it all, at least for a little while. It's also very prestigious, you'll have bragging rights, and once you become an attending physician, you'll make a lot of money, depending on your specialty. Just recognize that you won't be making that attending physician salary until you're about 11 or 12 years into it. The path to becoming a physician is also going to be very intense. You're going to be putting 60 to 80 plus hours in medical school every week. You're going to be passing very difficult examinations. You're going to be having to study pretty much all the time. And residencies typically work about 60 hours a week as well and get paid about the same as you would as a nurse. The path to becoming an NP is honestly fun. You'll have great nursing camaraderie. You'll learn a ton on the floor and in the units. You'll learn a lot about the healthcare infrastructure and how to navigate it. You'll start making decent money as an RN right after graduating. And you can start making your provider salary sooner, depending on when you choose to go back to school. You definitely won't know everything, but you'll know what you need to know to take care of your patients. And if you don't know the answers, you'll know exactly where to get them. Both physicians and nurse practitioners are highly educated to treat their specific patient populations. And the research studies that we have currently show that NPs don't provide inferior care to physicians. If you guys want to know specifically what a nurse practitioner actually does, you can check out my video here. You can also see how much an NP makes here. Be sure to like this video, subscribe, and share this video with other people because sharing is caring and, well, nurses care. Send me an email if you have questions and check out my blog, healthandwillness.org.